I fairly quickly decided on surgery because my Gleason score was 6. I was young, I was healthy, and the gold standard treatment option, from my perspective, what I was told by multiple doctors, was the surgery. So I quickly got to a surgical option. My doctors thought that my tumor was in one side of the prostate. As it turned out, with the pathology, the tumor was larger than was indicated by the biopsy and the films, and was bilateral. It was through both sides of the prostate, which was a surprise, I think, for Herb. Certainly is, and it was a surprise for me, knowing that it was a more pervasive tumor. Having a doctor's as skilled a doctor as Herb's hands actually inside of me feeling it made me feel a lot better, and frankly was one of the driving factors of why I wanted to do open anyway. The comprehensive aspect of the treatment is so important in that the disease is life-changing. And it's not just the surgery itself. That's traumatic enough, but it's managing the side effects. And the side effects are and can be quite severe. And so having a comprehensive perspective on how to treat the disease and then manage post-cure the side effects, and primarily the incontinence potential and the impotence potential, are extraordinarily important. And without that, there can be serious lifestyle changing implications. And so you leave the hospital. In my case, I left the hospital quite optimistic, but you still don't know. You go home, you're sore from the surgery. You have a catheter, so that limits what you can do, limits the mobility. You're on pain meds, so you're a little groggy the first couple of days when you're home. But then you begin to rebound, and you rebound very, very quickly. By the end of the first week from when I was home, I felt great. I was off the pain meds. I was getting around. I was comfortable with the catheter, as comfortable as you can be. And I was ready to just get on with it. And then magic happens. You go back a week after, and they take the catheter out, and everything is perfect. And I will never forget that office visit. Literally a week after, and I walked in with a catheter, walked out without, and it was terrific. And for me, 2 weeks later, I was back at work. I took 3 weeks off. I probably only needed to take 2 weeks off, but I took 3 and went back to work. And felt fine, felt more than fine, and then the first major office visit following going home, Herb walked in with the great news that I was, at least from a PSA test results and the pathology, in his mind was cancer-free, and 50 months later I still am.